Hello everyone, and welcome to my CRPS education channel. Today we will be discussing how complex regional pain syndrome is diagnosed. The tool utilized during this diagnosis is called the Budapest Criteria. Now, before we get into discussing the Budapest Criteria, let's talk a little bit about what CRPS is. Now, if you would like a more in-depth explanation of this, I will link another video at the end. A quick overview. What is CRPS? CRPS is a malfunction of the autonomic nervous system. This system controls your automatic and reflexive bodily functions. These are things that your body does without you needing to actively control it. Because this is a malfunction of the nervous system, there are multiple methods of manifestation and ways that CRPS can present. Complex regional pain syndrome is currently the most painful condition known to exist. It is currently incurable, so once you develop CRPS, it is a lifelong condition. On top of it being lifelong, it is also rare, which means it is not particularly well known in the general public or in the medical field, and it's not well researched or well studied. This is one of the few disorders that gets the label of the suicide disease. Unfortunately, those who suffer from CRPS, who do not receive the medical care that they need, often end up killing themselves for relief from their pain. Now that we've got that out of the way, let's talk about diagnosing criteria. There are two important terms you need to know about diagnosing criteria: the sensitivity rate and the specificity rate. These two partners work in combination but in opposite directions. Sensitivity rate is a true positive. This is the ability of a criteria to correctly identify those who have the disease. The second rate is the specificity rate. This is a true negative. This is the ability of a criteria or a set of requirements to correctly identify those without the disease and not give them the diagnosis because they fall outside of the requirements. The prior criteria, before the Budapest Criteria was implemented, was created in 1994. It had a very high sensitivity rate. So if you did in fact have CRPS, it had a 100% rate of being able to say, yes, you do have it. However, it had a poor specificity rate of 41%, meaning you don't actually have CRPS, but the criteria was broad enough that you fit within the requirements. This could lead to potential overdiagnosis of CRPS. Why is that a bad thing? If you do not have CRPS, remember, there are not very many effective treatment methods for it, and it is incurable. If you had something else that was treatable and was able to be cured, but you got a CRPS diagnosis, well, there you are now missing your ability for wellness. Because of that, new criteria with better accuracy was needed. The International Association for the Study of Pain met together in 2004 at a conference in Budapest, Hungary, to create new guidelines for CRPS diagnosis to make sure only those with CRPS were actually receiving diagnosis. This is where the Budapest Criteria was created, and this is the criteria that we use today. The Budapest Criteria retains the exceptional sensitivity rate, only dropping 1%, so it's a 99% sensitivity rate. However, it greatly increased the specificity rate, almost doubling it, raising it to 68 to 79% ability to say whether or not you do, in fact, not have the disorder. So what are the diagnosis requirements? There are two major categories, and each major category has 4 subcategories. Let's talk about the broader section first. First, there needs to be an injury, and the pain one would feel in regards to this injury is disproportionate to what you would expect. Next, we're going to talk about signs and symptoms. Now, these two are very closely intertwined, but they are slightly different. A symptom is something that the doctor does not necessarily need to see, but that you, the patient, have experienced, something you report. As far as symptoms go, the patient needs to report at least one sign in 3 or more of the categories we will talk about in the following slides. There also needs to be signs. These are things that are present during a physical examination by a medical professional. There needs to be at least one sign present in 2 or more of the categories we will be talking about in the following slides. And finally, this is a diagnosis of exclusion, which means no other diagnosis can better explain the signs and symptoms you're experiencing. Again, as we discussed earlier, this is important because if you have something that can be treated and made whole and well again, of course, you would want to do that. The following categories are physical manifestations of your malfunctioning nervous system. Those categories are sensory, vasomotor, sudomotor and edema, and motor and trophic. First, let's talk about the sensory category. Now, this has to do with your perception of pain, and there are two main subsections here, allodynia and hyperalgesia. Allodynia is having painful reaction to a non-painful stimuli. This could be from physical pressure, someone touching you, water touching you, fabric resting against your skin. This could be from temperature, maybe warm shower water or cold air. This could be from barometric pressure change as cold weather comes in, or maybe a storm is brewing. This could be from vibration, maybe micro vibrations at a very loud concert, maybe the vibrations of your car. Next one is hyperalgesia. Now, this is a cousin to allodynia. They are both caused by a reduced stimuli threshold in your autonomic nervous system. Hyperalgesia is having a painful reaction to a slightly painful stimuli. This could be something like a break in the skin from a needle stick or a puncture, a cut or a scrape. This could be from some sort of extreme temperature like ice or a very hot pan. This could be from compression like stubbing, crushing, slamming that body part in a door or a window, or catching. Maybe you got caught in your zipper, maybe you got pinched, maybe you bumped into a table. Now, you would need to have at least one of these requirements to fulfill the sensory perception. So if you are experiencing allodynia because your clothes are causing you pain and you can't stand to be in the car because it hurts you, well, there you have now fulfilled the sensory requirement. Let's move on and talk about the vasomotor section. This has to do with your blood vessels. This manifests in two major ways: your physical temperature and discoloration. Your temperature will affect your skin, causing asymmetry of greater than 1 degree Celsius. Now, this could be in just your affected area, maybe your wrist. This could affect your whole arm, or this could affect your whole body, where maybe your limbs are very, very cold and your torso is very, very hot, where you are not keeping a consistent temperature throughout the entirety of your body. Internally, you might feel meltingly hot or radiating cold. This is a good indication that your body is not maintaining homeostasis, a good baseline. Now, discoloration. Discoloration can affect just the area that you are in pain, or alternatively, the entire body. This has to do because your blood vessels are either too open or too closed. If your blood vessels are too open, that means you are leaking blood into the surrounding area. This might make your skin look red, pink, purple, magenta. If your blood vessels are too closed, that means you are not getting enough blood to that area. You might be noticing your skin being abnormally white, gray, blue tinged. This is known as cyanosis, or corpse-like appearance. You might also notice red laser-like dots or mottling. Now, mottling is this kind of splotchy, reddish, purplish, bluish, whitish kind of branched circular appearance on your skin. And this one can be subtle. This is all related to your blood vessels as well as your cardiac and pulmonary functions. Those are your heart and your lungs. And also, once your blood vessels get involved, this will, of course, also relate to your blood pressure. Let's go back to this hand example. You're experiencing CRPS in your wrist. That area is purple. Well, there you have fulfilled the discoloration requirement. Or perhaps it is blue and very cold and a different temperature than the rest of your body. Well, that is both the temperature and the discoloration requirements for this vasomotor section. Let's move on to sudomotor and edema. Now, sudomotor has to do with your sweat glands and when they are releasing sweat. Edema just means swelling. People with CRPS often at some point or another have a sustained season of severe sweating. This could be just in the affected area where that limb is producing an abnormal amount of sweat, or this might affect the entirety of your body. The sweat you produce might be a mild amount, or it might be quite severe to the point where you are dripping sweat constantly. As far as swelling goes, you might notice this in just the affected area. You might also notice this in your hands and feet, regardless of the limb. You might also notice this in your joints. This could be mild to severe, severe enough to the point where your body part is twice the size that it should be, or mild enough where it's just a little bit of extra padding around your joint or the area, and someone who isn't familiar with what your body should look like might not be able to notice it. Also, this can be disguised by either weight loss or weight gain and the reduction of muscle mass. And our final section here is the motor and trophic category. The motor has to do with your actively controlled movement. These are your muscles, your bones, and your joints. This looks like a reduced range of motion, reduced stamina, reduced strength, reduced stability, dystonia, which is those uncontrolled muscle contractions, clenching, cramping, tremoring, twitching, fluttering, joint stiffness, joint pain, partial or full dislocation. This is caused by a reduction of energy produced by your mitochondria. And our final section here is trophic. This has to do with your nutrition and your hormone levels. This is going to affect your hair, your skin, and your nails. This might look like rapid or slowed hair growth. This might be on your head, or this might be in the area where you're experiencing your pain. This might look like rapid or slowed nail growth. This might look like thin, brittle, thick, or clubbed nails. This might look like grooved, ridged, or spotted nails. This might look like thin, dry, oily, shiny, scaly, or itchy skin, or spontaneous bruising, where you now have a bruise, but you're not quite sure where it came from. So, again, quick recap, because we've covered quite a bit of material here today. To get a diagnosis for CRPS, you need to have an injury where your pain is disproportionate to the inciting event. You need to report at least one sign in 3 or more of the categories, and you need to present during the time of physical examination one sign in 2 or more of the categories. Now, they need to be present during the time of physical examination. This can cause some problems because, very much like the ocean, your nervous system is a dynamic system, which means it can come in and go out, high and low, ebb and flow. So not all symptoms are going to be present at all times. And you cannot force symptoms to appear or disappear. If you could, well then, the whole treatment for this would be an entirely different monster, wouldn't it? So, your best bet here, if you are still trying to get a diagnosis, write down what you're experiencing. Write down dates, write down times, write down symptoms and signs so that when you go to your doctor, you can go with hard evidence. And finally here, this is a diagnosis of exclusion. So again, no other diagnosis can better explain the signs and symptoms that you're experiencing. Those categories, once more, are sensory, which is allodynia and hyperalgesia, vasomotor, which has to do with your blood vessels and your temperature and discoloration, Sudomotor and edema, which has to do with sweating and swelling, and then motor and trophic, which has to do with movement and nutrition. If you are still looking to get a diagnosis, because you do not currently have one, your best bet is going to be looking for either a neurologist or a pain management specialist. These are going to be the 2 broad categories in the medical field that are going to be best suited to working with and recognizing CRPS. One final note here before our final slide. Your best chances of managing CRPS in the long run are to get it under control within the first 6 months of the onset of the symptoms. Once you have gone beyond that, you are in a different operating system. Your brain has changed its neuroanatomy, and it is much harder to deal with CRPS once that happens. If you are in the American healthcare system, getting a diagnosis of exclusion means lots of tests and seeing lots of different doctors, and that takes a lot of time and money. Especially if you are unable to work and you now no longer have your health insurance or funds coming in where you can go get the medical help that you need on a regular basis, this can be very difficult. You need to be a patient advocate for yourself. You need to take responsibility for your own health. And the best way to do that is to making sure you are informed about what is going on inside of your body. That is where we're going to draw this video to a close. Thank you so much for watching. If you would like to see more of our videos, please hit that subscribe button. If you would like to contribute to my medical expenses fund, my Patreon here is down to the left. The relevant sources utilized for this video will be linked